I'm Croaky here at the Doctors for the Environment Australia conference, and I'm talking to Dr. Bastian Seidel here, who you are president of the Royal Australian College of GPs.
I am indeed.
And you've just been involved in a panel discussion
Yes.
about what colleges should be doing. One of the things you said was that you see yourself as a climate witness,
Yes.
and you say not a day goes by as a GP where climate change is not an issue.
Yes.
Can you talk to that?
Sure. So look, GPs are living and working in their communities, and as I mentioned before, 86% of all Australians see their GP at least once a year. So of course we are seeing the health effects of climate change in Australia, whether it's now metropolitan, whether it's outer metro, or whether it's in the country. So it's pretty obvious. I'm a GP in Tasmania's Huon Valley, southwest of Hobart, and not a day goes by without patients telling me the effects of climate change they experience, and those are health effects, and we as GPs need to be empowered to deal with them.
And it's a big issue. There's been a study recently in the US about that. Most people accept the science of global warming, but
Yes.
don't see it having personal impacts, and that's a big issue for people around advocacy. So what are those personal impacts that you see?
Yes, one of the examples I keep mentioning is that there was meant to be a hay fever season in Tasmania, certainly in the southwestern part where I practice, and that doesn't seem to be the case anymore. Hay fever season is now over 12 months because pollen, prevalence is completely different. There are different plant species now that flower, quite randomly. So it's quite chaotic. So you see patients who are coming in with hay fever symptoms who shouldn't be coming in. And that's quite difficult because it does have implications for treatment, it does have implications for further assessment, it does have implications for ongoing management. This is just a very small example of what we see, but nevertheless, it's certainly a change compared to what I experienced even 10 years ago.
So therefore, what should colleges be doing, and the medical profession in general? Where do you see it? Or what are they doing at the moment on climate change, and where does it have to go?
So evidence currently is rather sketchy, isn't it? And I think there was a drive to develop more evidence, more research evidence, to put more research funding into climate change and health, effects. And I don't think that's very prominent now. We need to go back again and say, look, if we really want to tackle the health effects, we need to put proper funding in there. And it's the role of the colleges to curate this evidence and to make sure that evidence influences the curriculum for undergraduate, but postgraduate education, of course, as well. Academic medical colleges are meant to follow the evidence, and our members are holding us to account for us to follow the evidence. So it's very clear that we need to take the health effects of climate change very, very seriously.
You feel that from your members?
Absolutely. There's not, I don't want to say not a single day, but I get regular reminders about what the college is doing with regards to climate change. Certainly when I started my presidency, we had good meetings with members who are active in the climate change space. And look, we are going to make this part of our curriculum. Those groups are working on it now, and I get regular updates, and I'm looking forward to see climate change featuring quite prominently in the curriculum of the RACGP for general practice.
You also mentioned that climate change is not appearing prominently in talks with government because a lot you're so caught up in things like the Medicare benefit scheme and things like that. What's the problem with that, and how do you break away?
It's sad, isn't it? But it's often day-by-day basis, day-to-day business that we are discussing with the levels of government. And let's be frank, that really does involve, appropriate and sustainable funding for general practice. So you would love to bring up other issues as well, such as climate change, but the time does not allow that. Sad as it is, but that's the stark reality. And as I've mentioned, I've been president now for quite a few months, and there was never once the opportunity to bring up health effects of climate change. And quite frankly, that was actually not on my agenda. So again, we need to change this again. Once we've established that appropriate funding is necessary for us to provide quality care in general practice, then we need to move on to address the health effects again. And that, of course, is the health effect of climate change, amongst many others.
Okay, coming up next, sadly for me, who is not accustomed to public speaking, is a media panel about talking climate change and health. What have you found to be the barriers to actually get into the media with the messages that you want on climate change and health?
It's interesting, isn't it? I think one of the examples I gave earlier today was thunderstorm asthma, and that of course was very prominent in the mass media when that actually occurred in Melbourne, in Victoria, fairly recently. Saying that, we know that thunderstorm asthma may well be a sign of climate change that we are seeing more prominently. We wrote about this a decade ago. So again, it's been out there. Looking at the media now, there is no association between thunderstorm asthma and climate change at all. So it's a complete, disengagement of a very topical, issue there.
And do you actually mention that when you're talking to journalists about that, and it just doesn't rate the story? Or?
No, in this particular instance, I wasn't asked, I didn't give comment. But again, other organizations like the National Asthma Council, Thoracic Society were featuring quite prominently when they talked about thunderstorm asthma. So again, they probably don't necessarily have the understanding that climate change could be a major contributor there. And I wouldn't expect them to. But frankly, I would expect the journalists to do the investigative reporting in this area to say, look, what's actually at the cause of it? What do we actually need to address? We need to stop reporting headlines on. We need to start reporting beyond the headlines. And realistically, that's also the job of the journalist now.
As one final question, how will you measure your success in your role on climate change and health?
I think that's an excellent question. Thanks again. So again, I would like to see climate change featuring really prominently in the curriculum for GPs. I'd like to see it featuring prominently in the curriculum for our Fellowship of Advanced Rural General Practice. I'd like to see it featuring quite prominently when we talk about Indigenous and Aboriginal health issues as well, because those communities are severely affected by climate change effects. I would like to see the Council of Presidents of Medical Colleges to consider a joint position statement on the health effects of climate change, and that's something we are going to discuss when we have our strategy meeting later in April. I can't see any reason why we can't achieve consensus. Again, medical colleges are meant to follow the medical evidence. I think the medical evidence is very, very clear out there, so we just need to do the job our members expect us to.
Thank you very much.